slightly rearranging the agenda. Mike Fisher, who was listening earlier in the conversation, there were some questions that came up about Medicaid and Medicare. He's going to speak generally to any health insurance questions, issues that may be of interest to us and to our areas of jurisdiction. And then we're going to hear about specifically about the Bridges to Health program. That was also mentioned this morning. And we're going to take some testimony on the migrant education program. And I will say that those are two programs that we have not in the committee, I think, heard much about over the past few years. And I personally am not, it's not just the committee, I personally don't know very much about either of them. And I'm not expecting that we're going to become expert on them today, but I've asked just to get some testimony, keeping in consistent with the theme of what's been changing over the past few months that we should know about. And then we also have Jill Martin-Diaz from the Asylum Assistance Program, who may be joining us and may be able to answer any questions or also give us some insights there too. And then after that's all done, we'll be hearing about SNAP primarily, and then some of forest industry. So, and I promise we will be done by 4. With that, Will, if you want to unmute and just introduce yourself. I think you've been in the committee. You have been in the committee before, and perhaps Jose Ignacio has been as well. I'm not sure.
Thank you very much, Chair. Pleasure to see you all, even if on Zoom. And we're actually zooming in from Randolph right now. We're at the Civil Rights Summit held by the Vermont Human Rights Commission. We'll be speaking on a couple panels later this afternoon, but happy that this time slot worked, and thanks for having us on. Again, for the record, my name is Will Lambeck. I'm with Migrant Justice, and I'm joined by Jose Ignacio. He'll be providing some testimony in Spanish. I'll be interpreting into English for the committee. And then later on, when he finishes, I might add some things in as well. But with that, I'll turn it over to Jose Ignacio, and he can introduce himself and share a little bit with you all.
Great. Thank you. Welcome.
Okay, sí, pues, hola a todos, pues, sí, pues hoy quisiera platicar un poco sobre las cosas que están sucediendo ahora, y igual recordar un poco de lo que me ha pasado a mí también.
So hi, everybody. I'd like to share with you a little bit about the changes that we're seeing right now, and also speak about my personal experiences with that.
Sí, pues quisiera tocar como 2 puntos importantes que, bueno, para mí son muy importantes. Y pues el primero es como la comida, ¿no?
And I want to share a couple things that I think are really important, and the first of them is access to food.
Sí, entonces voy a recordar un poco como cuando yo llegué aquí a este estado de Vermont. Igual pues estaba la administración del presidente Donald Trump.
And I want to go back to when I first came to Vermont was during the first Trump administration.
Sí, y pues yo estaba trabajando en un rancho lechero, y pues era pegado a la frontera, y pues los patrones pues no dejaban que nosotros saliéramos a la tienda a comprar porque tenían miedo a que nos fueran a agarrar.
And I came to Vermont, and I was working on a farm, and the farm was close to the border. And our employer didn't allow us to leave the farm property out of fear that we would be detained by immigration authorities.
Sí, y pues como bien saben, pues nosotros no hablamos el inglés, y la comunicación con los patrones pues es muy limitada. No es que sea mala, sino pues por nuestro lenguaje, y el traductor del teléfono pues ha sido muy limitado siempre.
And communication is always an issue. As you know, many dairy workers don't speak English, and it's not like it's the fault of the employer. I'm not saying that there's bad communication. There's a communication barrier, and even using the translators on our phones, which help a little bit, you have very limited communication because of the language barrier.
Sí, él nos decía que él nos compraba la comida y que se lo escribiéramos en un papel y nosotros lo escribíamos como si queríamos tomate, cebolla, pollo o carne, siempre lo escribíamos en un papel y lo traducíamos con el teléfono.
And so in our case, the employer offered to do the shopping for us. The farmer would go to the store and we would write down on a piece of paper and we would, use our phone translator to figure out what the words to write should be if we wanted chicken or tomatoes or onions or whatever we wanted.
Sí, pero cuando nos tocaba escribir que queríamos algún tipo de especie como ajo, cilantro o comino, algún tipo de especie que nosotros usábamos en específico, pues él traía lo que podía porque pues no sé si la traducción del teléfono era mala o no sé, o no lo encontraba, realmente no sabíamos qué pasaba, pero siempre pues nos traía cosas diferentes.
But the language barrier created its problems, right? So even with the goodwill of our employer, if we wanted specific ingredients, we would do our best to write them down, but that wouldn't necessarily be the ingredient that was brought back. Maybe we wanted a certain type of spice, cumin or cilantro, but we wouldn't always get the food that we were hoping for.
Sí, y pues eso nos limitaba también a nosotros la forma de cocinar en la que pues estamos acostumbrados nosotros y al final del tiempo pues teníamos que pedir lo que él nos entendía y ya no pedíamos esos tipos de especies y pues siempre teníamos que comer como una o dos tipos de comida siempre repetitivas.
But that limited the access to different types of meals, and so for ease, we ended up just sort of writing the same ingredients each time, and would end up cooking the same thing every day.
Sí, y pues entonces cuando encontramos a las personas que nos podían ayudar a comprar ese tipo de especie que queríamos, pues también ahora pues es muy limitado porque igual es como la patrulla fronteriza, pues no le está dando como ese acceso también a las personas para que lleguen a los ranchos.
And so the farm worker community has tried to find other workarounds, finding other people who can bring different types of food, the types of food that we eat, to the farms. But there's a difficulty there because Border Patrol also is an impediment for those people to be coming to our farms and coming to the farms and delivering food.
Sí, pues yo así pasé como por 1 año y 4 meses encerrado en ese rancho hasta que pues unos familiares como igual me dijeron que me fuera como más hacia el sur, que allá había más oportunidad de salir a la tienda.
I was on that farm for about a year and 4 months until some family members of mine who are working in a different area of the state said, "Hey, there's a job opening on our farm, and you can come, and there's a little bit more freedom of movement, and it's easier to get to the store yourself."
Sí, pues a base del tiempo, pues conocí a Justicia Inmigrante y se ha luchado por muchas cosas que ha estado ganando, como licencias para poder salir a manejar y ir a la tienda.
And I've been involved with the organization Migrant Justice because that's a way where collectively we can fight to try to change the situation in the state and expand access to different things, to have greater freedom of movement, for example, which is what led to the expansion of driver's licenses in the state.
Sí, y pues igual, no sé si conocieron un poco de mi caso también. Yo soy una de las personas que me he dedicado también a llevar comida a los ranchos. Después de que salí de los ranchos, estaba apoyando a mis ex compañeros también, llevándole comida y cosas que he comprado en la tienda y se los llevo a ellos también.
So there's been these advances, but there's still difficulties. And so maybe some of you recognize my name because now, these years later, I'm no longer working on a farm, but occasionally I'll bring food out to farms when workers I know have requests. I'm sort of filling that role of helping provide access to food. But that brings me back to farms along the border and in the northern counties.
Sí, pues a mí me detuvieron saliendo de un rancho cuando llevaba comida cerca de la frontera también. Entonces, pues la comunidad se organizó, siempre hemos sido una comunidad organizada y pues tengo como ese libertad ahora de estar aquí de nuevo con ustedes, pero no todos mis compañeros corren con la misma suerte.
And so after I delivered food on a farm, I was driving away, and I was pulled over by the Border Patrol, and I was detained and held in detention. And because I'm part of an organized community, we've always been organized. We mobilized, and I was able to be released. But that's unfortunately not the fate of many others in my community who have been detained. Most people who are picked up don't end up getting released. They're deported.
Hoy de nuevo la comunidad sigue siendo atacada de nuevo con esta nueva administración. Entonces los compañeros de los ranchos ya no quieren salir porque ellos están viviendo mismo en el rancho. Ahora ellos están sufriendo en esas condiciones que yo antes sufrí también. Entonces, y también las personas que pueden llegar a los ranchos, que se atreven a manejar y llevar comida, también han sido atacadas por la patrulla fronteriza.
And so right now we're seeing a situation where things are sort of moving backwards, and the same limitations and movement that I experienced when I first came to the state is what people are experiencing now. And not only for the farm workers themselves, but people like me who are part of the support system for farm workers, bringing them food, are also under attack.
Sí, y quisiera como un poco como aclarar esas dudas que a mi forma de pensar que los ranchos no van a cerrar porque se va a ir las personas que están trabajando ahí, la comunidad, porque la comunidad vive en los ranchos, entonces creo que la comunidad no va a irse, pero va a estar sufriendo todo el tiempo.
And so from my point of view, the impact of all of this isn't necessarily that the farms are going to close because they're losing their labor force. It's sort of the opposite, because the workers live on the farm property, but they become more constrained and they have to remain on the property, and that creates consequences for them.
Sí, y pues otro punto que quisiera tocar también es el acceso a la salud. Y igual, pues me pasó a mí, yo estuve como más de 15 días con dolor de muela que pues tenía yo una carie, entonces realmente era como una operación para que me quitaran esa muela y pues no encontraba ninguna persona que me llevara a un hospital.
And then another consequence of this has to do with access to healthcare. And I can also share a personal experience. When I was working on a farm, I had a pain in a tooth, and the tooth had to be removed. But I couldn't find anybody who would bring me to a hospital. And so I worked for 2 weeks with that pain in my mouth.
Sí, entonces yo hablé con los patrones que yo necesitaba ir al hospital y pues ellos realmente yo sentía que tenían miedo llevarme al hospital y lo que hacían era como me compraban pastillas para calmarme el dolor, pero pues ahí seguía constantemente el dolor. Después como de 15 días vuelvo a repetir, ellos como me lograron sacar una cita con el dentista que ellos usaban y pues... Cuando me sacaron del rancho, me dijeron que yo me acostara en las sillas de atrás y que no me levantara para nada. Y cuando llegué al hospital, me metieron por la salida de emergencia y por ahí mismo entré y por ahí mismo salí.
And so when I brought this up with my employers, I said I need to go see a doctor about this, and I could tell that they were afraid to bring me to the doctor, because for 2 weeks they just gave me some painkillers, some pills to take, and said, "Here, take this." And but after 2 weeks, when the issue hadn't resolved, they finally agreed to get me an appointment. But I could still see the fear that they had, because they said, "Okay, we're going to drive you to the hospital, but we need you to lie down in the back seat when we're driving you." And then when we got there, instead of using the main entrance, they like brought me in the back door through the emergency entrance, and that's how I left as well.
Sí, y pues ahora mismo igual están sufriendo mis compañeros también de que no hay forma de ir al hospital. Si a ellos tienen algún accidente con alguna máquina o con alguna vaca que los llega a lastimar, ellos no tienen acceso a la salud rápidamente.
And now we're seeing that same thing happening in the community again, a lack of access to healthcare. That if you're working on a farm and you get kicked by a cow or have another workplace injury, many workers are experiencing that and don't have a way to go seek medical attention. They just have to deal with the pain.
Sí, por eso para mí es muy importante que se apoyen también a los grupos de personas que están trabajando en acceso a la salud, como Puentes a la Salud también, que es un gran respaldo para la comunidad.
And that's why I think it's really important that you all find ways to support organizations that are providing access to healthcare, like Bridges to Health, for example, which is doing really needed work right now.
Sí, y así podríamos seguir platicando de muchas experiencias que me ha pasado, pero también quisiera escuchar de los demás.
So I could go on and on, but I want to make space for other people to speak as well. So I'll stop there.
Muchas gracias también por escucharme.
Thank you for listening to me.
Thank you. Thank you very much, Jose Ignacio. And Will, did you say you wanted to say a few things? We may have some, let me just stop if it's okay and see if there are any questions before we go on. Committee members, any questions? Okay, Will, why don't you proceed then?
Yeah, thank you very much. And thank you to Nacho for his testimony. And I think, yes, I mean, some of the themes to draw out of that is this sort of trend that we are hearing over and over again from farm workers, especially those who have been here for 10, 15, some 20 or more years, is this sense of under the current administration and with current practices being pulled backwards. That when the immigrant community first started fulfilling the labor demand on farms in Vermont, as you're hearing from Nacho, there was this great sense of fear and great sense of wanting the community to remain hidden and remain out of sight. And over the years, really because of the bravery and organized movement of workers, things have really changed in Vermont. This community has really celebrated the changes that they've fought for and that the legislature has created: access to driver's licenses, fair and impartial policing policies to ensure that an encounter with law enforcement doesn't end with Border Patrol being called. More recently in the legislature, expanding access to higher education and healthcare and housing. These are all changes that have been achieved in Vermont and have really made this tremendous difference in the quality of life of immigrant communities in the state, and in particular, those who are living and working on the state's dairy farms. And Nacho's just going to look for some water here. But there's this sense now that in the past 9 or 10 months, a lot of those that progress is being put at risk. And the types of experiences that Nacho talked about when he first came into the state are now people are living that again and feeling like they're being pulled back into the shadows. And in some ways, it becomes even more difficult because the demographics of the community have changed so much as Vermont has become a more welcoming and opening place for immigrants, and as there are more rights and protections for people. What used to be a community characterized primarily by single men has now become a community full of families, and increasingly both men and women are working on farms. They're bringing kids with them, or kids are being born in the state. It's a much more diverse and varied community, and that means when there are more restrictive immigration practices and policies being put in place, it's families that are suffering as well. So a little bit of statistics just to sort of understand the trend. This year, since the start of the Trump administration, Migrant Justice has documented and worked directly with over 100 immigrants in Vermont who have been detained by ICE and Border Patrol. Those detentions have happened in more than 36 different enforcement actions. That includes very high-profile ones that you all are surely familiar with, like a Border Patrol raid on a farm in Franklin County in April that resulted in the detention of 8 farm workers. But it also happens in the more quotidian sense of traffic stops on Route 105 or back roads of Border Patrol pulling people over for driving while brown. These are, clearly racially profiled based stops, like what happened to Nacho in June of this month when he and a family member had just been dropping food off on the farm, were driving away, and were stopped by Border Patrol and ended up being detained for about a month before they were released. So there's been this huge increase in detentions. Just to give a sense, and this is more than a tenfold increase from the number of detentions we were seeing last year. And it has a tremendous impact because it's a relatively small community. It's a relatively tight-knit community. Every time somebody's detained, it's this wide network of family and friends and people from their sending communities who are impacted. And we say, every detention is a person traumatized, a family separated, and a community terrorized. So as Nacho was saying, the impact of this isn't to, at least in the short term, isn't to deny farms their labor force, because there still are workers who are on the farms who are doing the jobs. The level of detentions hasn't risen to the level where it's creating a disruption to the labor force. And I think, we see news stories from around the country sometimes where it's, crops going fallow in the fields because farmers can't find workers. That hasn't been the case in Vermont. To our knowledge, there haven't been any interruptions to dairy production. The real impact of these detentions is to interrupt that sense of progress and that freedom of movement that the farm worker community has achieved in recent decades, and to make people more captive on the farms where they live and work. And that creates really severe material consequences. And Nacho talked about 2 of them: lack of access to food, lack of access to healthcare, but it goes beyond that as well. This creates a breeding ground for more labor abuses. And, specifically, or I guess most particularly, we see that with sexual harassment, for example. If a woman is working on a farm and has experienced sexual harassment from coworkers, from managers, or from employers, but is trapped on that farm without freedom of movement, without an easy way to say, okay, things aren't going well for me here, I'm going to go elsewhere, or I'm going to try to look for resources to get support with this issue. That isolation breeds vulnerability, and that vulnerability breeds abuses. And those are real consequences that we're seeing from the increase in immigration enforcement due to changing federal policies and practices. So I wish I could paint a rosier picture. This has really been a crisis that the community is experiencing. The increase in detentions is at a volume unlike anything we've seen before in Vermont. This vastly outstrips the increase in detentions and deportations that we saw in the first Trump administration. And by all indications, it's going to continue to get worse. There is no relief on the horizon. We think detentions are going to continue to accelerate, both as policies develop and as capacity develops. But both ICE and Border Patrol are hiring more agents in the state. And with more agents, that's going to mean more capacity from those agencies to surveil, detain, and deport community members. So this is quite a difficult moment, and will continue to be in the coming session. We expect there to be some legislation put in, but I want to be realistic as well that the legislature is also quite limited in the tools that it has to really interrupt this pattern of increasing detentions. There are some things that can be done, and we look forward to talking about them in the coming session. But we know that it's also a federal matter. And the way that ICE and Border Patrol are persecuting community members in Vermont is unfortunately going to continue to worsen. So on that quite dreary note, I'll take a pause and see if there are questions.
It didn't come up this morning with the federal delegation, but one of the things in the One Big Beautiful Bill, as you just mentioned, I think, Will, was a substantial increase in funding for ICE to staff up and to help meet the president's goals of deporting however many millions of immigrants who are not here authorized to work, including the very people that we're talking about here in Vermont. I was on my phone yesterday and an ad popped up saying $50,000 signing bonus to come and work for ICE. And I think about the difficulty that we have in Vermont attracting people to our law enforcement jobs. And if I were somebody who was disposed to go work for the highest bidder, it's going to be tough to hang on to people if that is part of the compensation package. So just that was an observation. And then, Will, one of the last points you made, I wanted to just ask a question and then see if the committee has questions. You suggested that the environment that's created here might be allowing for more unreported sexual harassment or more sexual harassment, which seems plausible. But do you have any data or is there any way to quantify that?
Yeah, thank you for the question, Chair, and also for the comments about the budget, the big beautiful bill. And I can come back to talk about that. Regarding sexual harassment, there's no hard data that I'm aware of. I don't think anybody's quantifying it, but I can certainly tell you that we see it at Migrant Justice. We operate a hotline and are getting more calls about sexual harassment, other types of labor abuse, where we can clearly see the nexus between the lack of independence and autonomy that workers have under the current immigration enforcement regime that's causing people to be less likely to change jobs, is leading directly to more of these types of abuses from happening. And it's not that any of these are totally new to Vermont. I mean, these are things that Migrant Justice has seen on farms throughout the existence of the organization, unfortunately. But this is a moment where we see a greater vulnerability, and that is leading to an increase in cases. I can't really quantify it for the committee, but I can say that anecdotally. And then regarding the hiring, absolutely. There's a big hiring push. We know that the ICE office in Vermont has already brought on additional staff, and we know that they expect to be hiring more. And there's a 1-to-1 ratio of more agents means more detentions, means more deportations.
Committee questions? Are you able to stay for a little while, Will, in case something comes up, or do you need to?
Sure. Yeah, we can be on maybe 15 more minutes.
Okay. All right. We're gonna keep going then, just because we have more that we want to do. Thank you very much.
Thank you very much, Chair. Thank you, members of the committee.
And I'm going to ask Mike Fisher to join us, the healthcare advocate. You probably recognize.
And I'm bringing with me Alicia. I'm Mike Fisher, healthcare advocate.
And sorry to interrupt, Mike. Folks who might have something they want to put up on the screen at some point, if you're presenting, our practice here is to have you share your own screen. So if you need a link to do that, we will get it to you. But please let.
Let's adjust that right now because I forgot about it. Thank you. We need to make sure Alicia is the presenter. Alicia, why don't you introduce yourself?
Hello, thank you for allowing me to join you all today. My name's Alicia Rodrigue. I work with the Office of the Healthcare Advocate.
Welcome.
Thank you.
So thanks for inviting us. Alicia and I are going to go through a brief presentation. I did want to just sort of recognize, thank you for inviting me to this room. I spent a session a couple of lifetimes ago serving in this room in government operations under the fierce leadership of Cole Hudson. So I think that's probably 2002, 2003. I don't know, you know, what were you all doing? She was here watching us.
I served with Cola Hudson in years prior.
In years prior, okay, so,
In the 80s.
yes.
He was on the wall until what, about a year ago?
His portrait, yeah, it's there.
Yeah. So it's nice to come back to this group. So yes, we're going to go through a brief presentation. Why don't you go ahead and start it, Alicia, and we'll plug through.
Yes, I will attempt to share my screen right now. I sent a request to the hosts to allow me to have that capacity. Let me give it a shot. And it seems like as though right now the host is denying that capacity. Let me know if there is anything I am able to do.
The
to make
host,
that
the
work more
host is denying that she is denying that, so,
Kicked me out of the room.
oh dear.
I'm going to go ahead and start while you're
Yeah, thank you.
figuring that out.
Yeah.
The HCA is a position and an office defined in statute. So appreciate your support for creating our office and helping to ensure that we can do as good a job as we can. We have, just to give you a very brief, we have 15 people at the HCA today. 8 of them are advocates who are on the phone, helping Vermonters out who are having some kind of challenge getting the care they need, supervised by an attorney. And I wanted to make sort of, when I say this at the beginning and I say it at the end again, we are a resource to you, both for your constituents and for policy. You know, it is written right into the statute that we're supposed to be supportive of healthcare decision makers. And so we take that seriously and do our best to be responsive and to be something of a watchdog. We are independent, you know, contracted from state government to Vermont Legal Aid, and to be, you know, to be there, to be, you know, waving the flag when we see something going on that's we can really damage. We still don't have a presentation though, so.
So it does not look like I am able to share in this particular format. Mike, if you are fine, I am more than happy to just go forward and like have a conversation with you all today.
And if anybody's got a computer or a phone nearby, it is posted on our webpage, so
Yes.
pull it up too.
We'll muddle along.
Okay.
Yes,
Go ahead.
exactly. Yeah. I love more of a conversation-based format anyway, so this makes it much easier for me all to look at your faces this afternoon. So as Mike had mentioned, we are the Office of the Healthcare Advocate, and again, Alicia Rodrigue. And I am here today essentially to lay out HR 1 impacts on health insurance eligibility for non-citizens in Vermont. And when I talk about that, that is a big topic. So I just want to be straightforward at the beginning that I'm going to put parameters around some of the information that I discussed today. So I'm going to be talking about how this impacts Medicaid in 2026. And I'm also going to be talking about how this impacts qualified health plans, mostly for 2026, but also briefly at the beginning of 2027 as well. And the reason I put such strict parameters around that is because I do not want to disseminate misinformation or give people rules-based information that will enable them to comply with these policies in advance. I want, one of the key takeaways I want to bring to you all during this meeting today is to just recognize that there's a lot of information, there's a lot of confusion, and there's a lot of fear out there. And while people are still eligible for benefits that will help them access and afford care, I want them to take advantage of those benefits that will help them access and afford care. Insurance is not necessarily the key to accessing and affording care. As Migrant Justice had mentioned, you know, fear, safety, other larger systemic access concerns are still going to exist, but it can be a tool for individuals to help get the care that they need. So let's talk about the first benefit that I plan to outline. So I'm going to discuss health insurance changes to Medicaid as it pertains to immigration status for 2026. So I just want to say first, health insurance is complicated. the intersection of health insurance eligibility and immigration status feels even more complicated. HR 1 has both simplified and compounded some of the factors that add to those complications as well. But the first big change that the Office of the Healthcare Advocate has been tracking in relation to Medicaid eligibility for 2026 is going to take place at the beginning of October, so October 1st, 2026. And specifically for those of you who may not be aware, Medicaid, specifically Medicaid for Adults is the program that I'm talking about here, is a program that individuals over 19 and under 65 who have qualified income, so incomes under 138% of the federal poverty limit, are able to take advantage of. And when I talk about immigration status and Medicaid, the way that I typically start is that currently most non-citizens in Vermont are ineligible to access Medicaid for Vermont, but for some pretty significant carve-outs. So the first carve-out is lawful permanent residents who have had that status for 5 years, in addition to a number of humanitarian-based status. So these could be refugee status, asylee status, special immigrant statuses, and a handful of others that I'm not going to go into too deep of detail here. However, the big change that I'd mentioned before that's happening as of October 1st, 2026, is that those exceptions are going to become even more narrow. So the immigration status component for accessing Medicaid for adults is going to become more narrow. So the only individuals who are going to have a qualifying immigration status for this benefit are going to be individuals who are lawful permanent residents who have had that status for 5 years, in addition to 2 categories of immigration status, Cuban or Haitian entrances, or a specific status called COFA migrants as well. So that will be a really significant change that's going to take place starting in October. One thing that I do want to tease out a little bit further is that when we talk about these changes, those changes are specific to Medicaid for adults coverage. They are not going to have implications to another form of Medicaid called Dr. Dinosaur coverage. So that's for children under 19 and pregnant people as well. And there are no real immigration restrictions for Dr. Dinosaur for pregnancy or kids under 19 currently. You just have to have a lawfully residing immigration status and meet all the other criteria for that benefit. Another program that I want to highlight as well that will not be impacted by these changes is the Immigrant Health Insurance Plan, what we abbreviate as IHIP. And it is essentially a Dr. Dinosaur lookalike program for those in Vermont who do not have a lawfully residing immigration status. So for undocumented pregnant people and children under 19 as well. I really like to tease that out because there can be a lot of information out there in the community, and I absolutely do not want fear and misinformation to enable people to not take advantage of the benefits that they're eligible for.
I think we may have given you the permission you need to share the presentation if you want to.
Yeah, let's see if I can get this screen up. You know, when we talk about health insurance, sometimes having something to refer to can make the process a little bit easier. So I will attempt to share my screen, but I will not let it sidetrack us if we're not able to. Let's take a look. Oh, great.
Can I just pause for a second and ask, is the committee aware of the IHIP program? Just want to pause on that for a second.
The which program?
IHIP, the Immigrant Health Insurance Program. So this is something that the legislature passed, looking at you, Alicia, handful of years ago.
Yeah, it was passed in 2021 and enacted in 2022. It is as old as my child.
So it's relatively new and is up and running, and very proud of this legislature for moving it along, and it continues to be active and adaptable to children and pregnant.
Thank you.
I think I'm going next. Is that right, Alicia?
Whatever you would like to do, Mike, I'm here to support whatever progression. And we can also tag team this if any questions come up. So I'll give it to you.
So we want to talk for a minute about the premium tax credit changes. And so this has been in the news a great deal. I'm going to emphasize something Alicia already said. Say it again. There is a great deal of misinformation out there. And that misinformation is honestly coming from the political sphere. Because people in politics some people in politics are needing to talk about what a devastating impact this has on Vermonters and on our healthcare system. And we want to, in our presentation today and our presentation to Vermonters, to pause and say, hey, this is going to have a big impact on some Vermonters. Other Vermonters are still have very good affordable programs available to them. And so again and again, we want to say, check out what this means for you and your family. And if you have constituents who have that question, please send them. So yes, you've heard this in the news, the elimination of the premium tax credits over 400% of poverty. That will bring back what we used to call the premium tax credit cliff, which will be indeed significant for families that fall just over that limit. And a reduction in premium tax credits for families between 139 and 399% with federal poverty. Say again, there will be premium tax credits available to those families, but at the old income limits. There's been a number of people out there saying premium tax credits are going away. They're not. The enhanced tax credits are going. Individuals who are subject to the 5-year bar and under 100% FPL are no longer eligible for premium tax credits or advanced premium tax credits. Most people in this impacted group are senior immigrants, international students, and other low-income immigrants. This is about 200 Vermonters, and I want to pause on that point. I've heard DEVA say recently that the coming immigration changes, changing access to coverage is going to impact around 600 Vermonters. They are working at understanding that number. I am confident that their number is not accurate at this point. They don't ask the question about immigration status if it doesn't apply to their application. And so we are working to get as accurate a number as we can about that. Though I wouldn't be surprised if that total number of 600 goes up.
Mike, I'm just going to ask somebody, some enterprising person in the room, to look up and tell us what 400% of the poverty or 100% of the poverty level is for a 2-person household.
2,800.
71,960 for a household of one. It's 147,920 for a household of 4.
That's 400%.
Yes, this is what according to Google.
Yep. So what was the first number?
70 if you're just a single
person, yeah.
household. 71,960.
All right, so in a 2-person then is going to be 80, 90 something, and
Yeah.
Okay.
97,280.
Okay. Is that what is that currently? Is that this year? Okay, you're looking at AI.
I'm looking at AI on Google. Yeah.
All
That
right,
would
but
be
anyway,
so-
just for ballpark, that's helpful to have. Yeah.
We can make sure you have the chart fresh. Alicia, were you going to say something about that?
I was going to say the same thing, Mike. The income limits for Vermont Health Connect are really simple to look up, and we can absolutely provide that to the committee afterwards.
And then the last change is a change for DACA status Vermonters. Our understanding is that this may impact a few individuals, but not many. There are very few in this category. So the other major changes to mention is that there is a change, an elimination of the repayment caps. Now, you might not have known that there was a repayment cap, but today for 2025, for lower income people, there is a cap on how much people have to repay if they got too much advanced premium tax credits come tax time when they're reconciling. And this is a very important protection. As you may know, premium tax credits can be tens of thousands of dollars, can be huge. And that protection has been very important. And the elimination of those repayment caps make it super important, but even more important that people accurately report their income to Vermont Health Connect. Now, if you're an employee who gets a W-2 and you know exactly what you're going to get every month and, through the year, that's easy. Easier. You really know what you're going to get. But as you know, if you're an employee, if you're a Vermonter who is a contractor or an artisan or a farmer whose income is subject to things completely out of your control, it makes it much, much harder to accurately estimate your income and report it. And so I'm going to say, Alicia, I want to ask you if I'm saying this right. If you're a Vermonter who has that kind of a change in your income, a volatility in your income, I think it really makes sense to call and get some help from the likes of the Healthcare Advocates Office to do it in such a way that protects you from having to pay back large amounts of money. What do you think, Alicia?
Yes, absolutely. I think there are strategies we can talk to people about in relation to taking less advanced premium tax credit, potentially reporting out slightly higher income, or lowering taxable income at tax time. I do not want to say that we are going to have answers for every situation because this is complicated, right? And when people make more money than expected, it is typically a good thing rather than a thing that they imagine is going to have implications on their taxes. But we have worked with many members of the agricultural community to problem solve on these issues. And we're actually partnering with Rural Vermont and NOFA to do some webinars around this for individuals in those populations too, to strategize. But the Office of the Healthcare Advocate is certainly a resource.
Representative O'Brien had a question.
Oh, I just didn't know what DACA was, or in general, just remember we're ag and we're not
Yes.
the Committee on Health.
Alicia, I'm going to call on you to describe DACA. You've got it at your fingertips.
DACA stands for Deferred Action for Childhood Arrivals. I believe it was a status that was founded in the Obama administration. Don't quote me on that. I work in healthcare and not immigration law. And I believe that it is essentially a protective status for individuals who were brought to the United States as young people to try to have a pathway to a more stable status. But again, an immigration lawyer would be able to give a much better explanation.
Mr. Chair, I want to do a time check.
Yeah, we should probably click through your last two slides.
So let's go a little fast.
Fantastic. And very quickly, one impact that I do see having a pretty significant effect on agricultural workers in Vermont as it relates to affording and accessing healthcare is a change that is going to take place to advanced premium tax credit at the beginning of 2027. So we had talked about restrictions in relation to Medicaid and being eligible for that benefit. That restriction is actually going to carry over for advanced premium tax credit in 2027. So Mike had described a change for immigrants who are under 100% of the federal poverty limit in 2026. That is going to be more systemic and extend to all individuals who do not have the following statuses. So the following statuses are the exception to the rule. So individuals with lawful permanent resident status who have had that status for 5 years will be able to get advanced premium tax credit. Cuban and Haitian entrances, and that category of immigrants referred to as COFA migrants as well. So those are the only exceptions to non-citizens who will be able to access advanced premium tax credit to help lower that cost of affording a qualified health plan on Vermont Health Connect as of 2027. And when we talk about this rule change in relation to the agricultural community in Vermont, I do think this is going to have a big impact specifically on seasonal agricultural workers such as H-2A workers who are eligible currently to sign up for a qualified health plan and get advanced premium tax credit if they meet all the other eligibility characteristics. So I do see that as something that is coming that will help making affording healthcare much more complicated in the future. So very quickly, just to summarize, Some of my big key takeaways that I hope came out throughout this presentation is that these changes are not going to go into effect for Medicaid until October 2026 and in January of 2027 for the advanced premium tax credit that I had just described briefly. What I want to recognize is that these rules are complicated. They are intended to make people be afraid of taking advantage of these coverage, this coverage and benefit. However, the Office of the Healthcare Advocate is a resource, and we are encouraging people not to comply with these changes in policy in advance. So take advantage of the health insurance you are eligible for at this time. Additionally, one other scope of advice that we are going to be working with populations with or without health insurance is to promote some of the changes in hospital financial assistance. So Act 119 expanded hospital financial assistance. So Vermonters who have qualified incomes can apply for financial assistance with their hospital, regardless of immigration status and regardless of insurance enrollment. And this is just a way you can get in touch with our office. Thank you all.
Right, thank
And I'll
you.
stop the screen.
Representative Nelson.
Signing up for healthcare is like trying to build a school budget. Before you have all the data from the state. You know, schools are trying to build budgets now, and we don't know what the dollar yield's gonna be, we don't know. The equalized pupil count, you know, all this stuff, we don't know, and you try to build a budget. Why could we set up healthcare so you enroll using so you're enrolling for 26. Then when you file your taxes in 27 on your earnings in 26, and then they can come back and scold you. And this happened to me. We had to pay out $8,000. Farming was stupid when it made money. It was abnormal when they made money. But if you followed for your 26 with your 27 returns, and when you file for 27, you use your 26 returns, and there's no going forward to sting you backwards. Because if you file and you estimate high, they don't give you money back on your health care. Am I right?
I think that that Vermont Americans so first off, let me just recognize this is federal law.
I understand.
And I also want to recognize it is not, from my opinion, not the way to finance our healthcare system. But we're living under it. But my understanding is, Alicia, please tell me if I go astray, that Vermonter has an opportunity to take their premium tax credits that they're owed in an advanced fashion, month to month, to pay their premiums, or to say, it's easier said than done if you can't come up with money for your premium, to say, I'm going to go ahead and fund my premiums and I'll get my tax credits come tax time when it's reconciled. So
You can get,
you can.
okay.
Yeah, I think that's true. If you have if you are owed money, I think you do get it back.
Yes.
So let's try.
And Meg, I want to just thank you for being mindful of the clock.
Yeah.
I want to move as quickly as I can to the Bridges program, but if anything you want to wrap up with.
I want to wrap up with a comment about Bridges.
Yeah, good.
So you task us with working to do our very best to help all Vermonters get improve access to care. And what does it mean to be a Vermonter? It means you're here. Quite literally what it means, that you live in Vermont. And so we are very proud. We are proud to partner with other organizations and know that we need the help of other organizations to reach sometimes hard to reach populations. Bridges to Health is a key partner in that effort. We're a helpline. If you ask me how many people have this problem or that problem, I always have to say, the universe of people who might have this fact pattern, how many know to call the healthcare advocate's office, may be relatively small. So we know that it's imperative that we have different approaches to reach different populations. And so Bridges has been a key partner helping us, helping assure that that the population they serve has gains access. We work hand in hand with them on many cases, helping people get coverage. And in particular, and I say again, the immigrant health insurance plan that the state set up a few years ago. I don't know what percentage of Vermonters who came through that program got help, direct help from Bridges. 85%, I was going to guess even higher. Bridges to Health is the reason that program has been successful. So I'll just say, I'll even make the ask. I know that you are not a committee who's able to direct funding, but making sure that Bridges has stable funding going forward, and a long-term future here in Vermont with a long-term home is imperative. It's very important, and I wanted to give you that opinion from the healthcare advocate's perspective.
Good, thank you for that. Yeah, and as we transition here and come on over, I'm just going to sort of editorialize that we as a committee haven't. So we've been hearing just now about this program, and I suspect that most of us on the committee aren't very familiar or aware of even the existence of it. And if we were here in January, we would block out an hour plus to take testimony to learn about it just from the beginning. We've got roughly 15 minutes to understand enough about what Bridges is to be able to give some context for why we're having the conversation today, the impact on if there is an impact we're going to hear on our farm community. And do you want to put something up, or you just want to chat?
In the interest of time.
Okay.
I'm going to focus on a few.
Before you get started, Representative O'Brien.
Just, well, Michael and Alicia are here. I wondered from the conversations earlier today if there's ever been a thought of finding insurance for an occupation, in this case, farming. If we could cobble together either nationally or regionally farmers and offer, because in bigger groups, insurance goes down. If there's ever been some sort of thought into that.
I think the right thing for me to say is I am easily accessible and would love to chat with any member of the committee about questions like this, or I know there was a question earlier about Medicaid versus Medicare. Longer answer to that question. Reach out to me.
Okay.
My phone number's on that presentation. Happy to.
Thank you.
So my name is Naomi. I lead my health programs.
I'm sorry, could you say your full name for the record? Yeah.
This is not my usual place where I'm talking to folks, but Naomi Wilbama-Housen, my health programs, UVM extension. Thank you for passing it up and providing a little context. I think to start, I do want to give a little bit of a background of what Bridges Health is, as well as some numbers around who are we even talking about right here. We've heard some situations, but I don't know how much committee members know about estimates of immigrant and migrant workers. So I want to touch on that and then talk about the impacts that we're hearing about within kind of health access in the folks that we work with. So the main body of work with migrant health programs is Bridges to Health. It's health access programming that uses community health workers to focus on health promotion, health education, and health access with immigrant and migrant workers across the state. We actually started in Franklin County, where I grew up on a small dairy farm in 2010, and then over time expanded to be statewide. We use bilingual regional staff, community health workers, and they work with individuals and households and families and farms to make sure that they understand what the health needs are. They understand what the priorities are of the people that they work with. And more importantly, what are those barriers that exist for any one person to access care, and how do we get around those barriers? So as I mentioned, we do work with immigrant and migrant workers, not just farm workers, but today I'll be talking about our work with farm workers. I often talk about our work as kind of being a program of last resort, in some ways a catch-all. So we work with individuals that don't have the support of other organizations and aren't able to access healthcare services independently. And that's an important point in terms of, you know, why we exist or who we serve. We are in the middle of a fall immunization outreach campaign that we do every year with the Department of Health. And when we do those clinics on farms, that's open to anyone on the farm. So farm owners, family members, farm workers. And we've done, I think we're up to 10 days so far. We do about 15 outreach days on farms to 50 to 60 farms a year. I mentioned it's important to recognize who we're talking about. I tend to think about two different buckets of immigrant and migrant workers. So we have year-round immigrant workers. Those individuals tend to be on dairy farms, but not exclusively. They tend to be from Mexico. And this is a population that Will was talking about, where there's been a shift from primarily male individuals on farms doing farm work to family members, spouses, and children. So as an example, we went from serving in 2020, 33 kids, 2024, 141 kids.
Wow.
Huge, yeah, exactly. And within that, I think it was the last 3 years, we've seen 43 babies born to individuals that live on farms. The other group of people that we talk about when we talk about agricultural workers are seasonal workers. Alicia mentioned some of the impacts that they're going to be seeing in terms of health insurance eligibility. There are around 660 positions for the seasonal migrant workers. It changes every year. The employers have to go through a whole process of first trying to identify local workers and then become eligible to apply for workers that come from out of the country. They're here anywhere from 6 weeks to 10 months. And some people transition from one job to another. So we'll see someone maybe is out tapping right now. They prefer this because there's not a lot of snow, but they're tapping in the winter. They transition to crops. And then around 10 months are headed back home and then might come again for another 10 months. What else do I want to say about seasonal workers? Oh, they're on 81 farms. We've seen a huge increase in the number of farms that are requesting seasonal workers because they're having trouble filling the jobs that they have on their farms. So 10 years ago, that was about 40 farms. Now we're at 81 farms this past year.
Representative O'Brien.
Are these all H2A or are there other programs too?
All H2. What I'm talking about is just H2A, which is specific to agriculture.
Okay.
Yep. Most of the workers are from Jamaica. Most of them, over half of them, work on apple orchards, but that increase in the number of farms requesting workers is an increase really in diversified farms. So you're seeing ground crops, you're seeing people coming in sugaring. That's kind of a new thing in the past few years. People involved in honey production, some raising of livestock. So again, there's challenges with workforce issues on farms, and there's an increased reliance on immigrant and migrant workers. Let me think. I think that's all I wanted to say. They already mentioned most are from Jamaica, and the rest that we know of H2A workers are coming from Spanish-speaking countries, Guatemala, Mexico, places like that. Everyone we work with has their own unique set of barriers. Some of those challenges really are connected to systems issues. So the fact that health service providers aren't really well set up to serve immigrant populations as a whole, and that includes immigrant and migrant farm workers. And then some are in these individual barriers. Again, Nacho talked about those, we'll talk about those. It can include lack of transportation, concern about cost, access to I have mentioned access to transportation, work schedule, fear of leaving the farm, a whole myriad of barriers that really impacts whether or not they can access services. And that's not even talking about the current state of healthcare access in the state. If anyone knows anyone new coming into the state who needs a PCP or needs a dentist, it's months, maybe years to really get in. And that's the same for migrant workers and immigrant workers coming into the state. I mentioned that we have our community health workers. Each person has a region. We have 8 of them around the state. Their region is really looking at how big of a size they're covering and as in addition to that, looking at, what do we know about the population they might serve? So we have, a lot more people in Chittenden County, but we have a bigger region in the NAK, for example. The community-
Senator O'Brien.
Just quickly, with like H2A workers.
Yeah.
The say farmers who hire them are responsible for certain things like housing, right? Where does healthcare fall then? Who's responsible for that?
Nobody is officially responsible, well, the worker is responsible
Okay.
for healthcare. In the past, I think it was probably around 2010 or 2012, it was right around this time that we started doing this outreach work. Up until that point, there was a health insurance program that, at least for Jamaican workers, they came with that health insurance program. That ended, and since then, it's been really complicated. One thing that I should probably wait and mention when we're talking about the federal changes, but the removal of that cap of what a repayment would look like if you don't estimate your income correctly is going to have significant consequences for Jamaican workers, and we already have seen that when they have to sign a line saying, if you misestimated what your income is going to be, you're going to have to pay back money. People are like, well, I'm going to be back in Jamaica. I don't know if I'm actually going to be able to come back next year. I'm not going to necessarily have the money to do that. And so that already deters people from getting health insurance. And so with the removal of that cap, it's going to increase that concern and probably decrease folks signing up for health insurance. And then they're not going to be able to anyways in 2027. So I just want to say one more thing, I think, a few more things about community health workers and kind of what that role is. They provide a lot of health education. They make sure people are aware of what services are available in their local communities. They identify barriers. So again, I mentioned transportation. We work with a lot of community volunteers. We work through health insurance to make sure people have transportation. They do a ton of paperwork. Mike already mentioned the IDEP program. That includes probably like you've written your name 7 times and dated it 15 times. And, it's a lot of paperwork, right? So we're helping people kind of navigate those things. A lot of the time that community health workers are spending are really focused on using the existing healthcare system, which isn't really easy to access. And as I mentioned before, currently it's hard to even find appointments. So not to mention the tooth issue. Somebody calls us with a toothache right now, unless they are in significant pain, they're not going to be able to get seen anywhere other than urgent care. Like so again, anything that you've heard about access to care generally disproportionately impacts farm workers because they have all these other barriers that are layered on top of it. Over the past 3 years, I kind of looked back to see, well, if we're just talking about farm workers, who have we worked with? We've worked with 1,128 farm workers on 167 farms across all corners of the state. So it's a lot of people. And we coordinate almost 3,000 appointments, so about 1,000 appointments a year just with farm workers. And 35% of those appointments that we coordinated with farm workers or family members were with people that didn't have reliable access to transportation. And so we were working with people to figure out how do we make sure not just that they can make an appointment, but they actually can get there and get the follow-up that they need. A lot of things to say. Oh, and then the last 2 things I want to say about the health access piece, and then I'll talk about what we're hearing from community members in terms of the changes on the federal level. When we see that there are collective needs on a farm, so vaccine interest, for example, that's when we kind of work a little bit outside of the system to try and bring healthcare access to farms. The collaboration with the Department of Health has been happening for the past few years and has really been instrumental in making sure that not just farm workers, but farm owners access vaccines. They often say, yeah, there's no way I would have gone off the farm to do this, but I'm glad that I have that protection. And then occasionally, particularly within our H2A community, we'll have a handful of people that have a chronic health issue, in particular, high blood pressure. And so sometimes they're bringing meds from Jamaica, they run out of meds or they're going to run out of meds partway through. They don't have a primary care provider here. And so we work with volunteer providers to make sure that they can continue their meds until they can see their provider back home. And then the final piece around kind of outreach that we do, we work and connected again to something that Nacho, I didn't talk to Nacho ahead of time, but it really aligns with what I was planning on saying. In northern Vermont, there's a handful of food shelves that are really committed to making sure that everyone in our community has access to food. And so we collaborate with them, and there's a few hundred farm workers every 2 weeks that get food boxes delivered through community volunteers to make sure that we're filling some of that food access gap that Nacho talked about that's particularly acute right now. In terms of what we're hearing from clients related to changes at a federal level, some of this has already been spoken about. So, going back to the health insurance piece, mainly that will impact H2A workers, but will also impact some of our year-round workers as well. We're seeing an increased reluctance and an increased need for conversation about risks associated with applying for programs or even accessing care. If I go to the hospital, like, is there a risk of me, giving my name when I'm at the hospital? Is there a risk of applying for three squares SNAP benefits for my child, right? There's been a lot of stuff in the news about data sharing and what does that mean for how people can access information. We're seeing some out-migration as a result of some federal changes. We're also seeing some people just saying, like, I'm limiting time outside. Like, I had someone this year who said, I'm not gardening this year because I'm concerned about racial profiling. If someone sees me and drives by and sees that I'm brown, I'm concerned they'll call the police. So that type of thing comes up for sure. Our families, and as I mentioned, we have more and more families on farms, are being, really concerned about being separated from their families. They're concerned about the economic impact if someone is detained within their family. And then within seasonal workers, we are seeing that there's concerns about whether or not the visa program will continue next year. Will there be changes at a federal level that means that H2A workers are no longer able to come to Vermont, as well as the concerns about rising healthcare costs. So they're aware of some of those conversations that are happening, not as much on a state level, but within the US. And then the final kind of area that we see impacts is specific to health access programming. There is a concern, as Will mentioned, and that I just mentioned, around racial profiling, and that impacts who's willing to transport people to appointments. And so community volunteers, farm owners, co-workers are less likely to give someone a ride if someone doesn't have transportation. We know they're going to delay care. If they delay care, they're more likely to end up in the emergency department, which is more costly for everybody involved. Oh, and then this kind of random thing came to me as I think Mike was talking. There's a number of FQHCs that rely on international dentists to.
Sorry, FQHC.
Oh, sorry, community health center, federally qualified health centers. They're also known as community health centers. So it's Notch in Franklin County and CHC in Northern Vermont, CHC. So there's maybe 10 or 11 across the state. And it's where someone can apply for a sliding fee, and depending on income and family size might get reduced care. Many of them rely on dentists that come from out of the country. You may have read the news. There's a cost now associated to specialized visas. And so they're trying to figure out whether or not they can hire dentists anymore. And so someone in the situation like Nacho may have to go a month or two instead of, 2 or 3 weeks, which is, in my opinion, bad enough to suffer the tooth pain. Maybe the last thing around the impact of changes at a federal level on health access programs, specifically our program, is just that there aren't federal funds for health equity work. And so that has an implication for the type of work that we're able to do, the kind of breadth and depth of the work that we can do. We know that having healthy workers means we have productive workers, and we need productive workers for the farms. I think most people in Vermont have seen that at this point. We also know that if people miss work or they have to leave work for any reason, there's a cost associated with that. You lose knowledge, you lose skills. So the farm owner, farm manager has to take more time to train new people. And again, the other point I just want to underscore again is when people delay care, they're more likely to end up being ED, which is again, not helpful for anyone. So the last thing I'll say, and then I'll hand it off to Esther, is just that we know how important this work is. We know that health access is really important for healthy farms, and we're going to just continue to do whatever we can to make sure that we can continue doing this work.
Thank you for fitting all that into
Sorry, that's a lot. It was
just a few minutes, really. Yeah. Very quite interesting and interesting data. As I say, I wasn't really familiar with what the program involved, and hopefully you'll be able to come back in January and we can learn even more. So why don't we, in the interest of time, have you trade places with, as they do while they're getting situated, is by the time I find it, you're gonna be able to say program lead.
Yes. Yeah, so.
Yeah.
Great.
Please introduce yourself. Yeah.
Would love to. I'm Esme Hamilton. I am the program lead for farm worker education programs at Union Extension. I work in Miami. And so we help farm workers and their children, migratory farm workers and their children, to access educational opportunities both within and outside of the school system. We have two main programs. One is the Federal Migrant Education Program, Title 1C, that's sub-granted test by the Agency of Education. Whether that program will continue or not is nobody knows. We didn't know. This year our funding was significantly delayed, but we did get it funded at the 2022 rate. So unknown whether that will continue. That program works with kids who were in school, birth age 22, in school or out of school, as long as they don't have a high school diploma and they meet this technical criteria of migratory, which means that you've moved across school district lines in the last year to take to seek or engage in temporary or seasonal agriculture. So there were, as Naomi said, there are a lot more workers on farms than qualify for the Federal Migrant Education Program. But we work with kids in that program. And then we also, since 2020, we've had the Farm Worker Education Hub that's funded by a few different grants that ultimately go back to USDA to do online and on-farm classes, specifically for Spanish-speaking farm workers that are English for the workplace and some of their like workplace, skilled workplace orientation kind of stuff. So we work with kids, we work with, and their families, we work with adults. The program for kids, we are able to do much more like wraparound service. We're doing instruction for them. We're doing supplemental instruction for example, a 16-year-old kid who just got here with his family and is in school, but just started school, doesn't speak any English. And the rural school is trying to hire their first English language instructor. And in the interim, we're providing some supplemental English instruction for that kid, tutoring, all kinds of services. Like it looks like helping children enroll in school. All these kids that Naomi was just talking about, those 43 babies who were born in the last few years, those kids are needing childcare. They're entering preschool. Their families are trying to figure out the logistics of transportation to a preschool program that's 2 hours a week, 5 days, 2 hours a day, 5 days a week, something like that. There's no public transportation to preschool. So we spend a lot of time with families trying to navigate those logistics, getting scholarships for after school programs, going to parent-teacher conferences with them, really everything that a family needs to support kids who are in school. And for young workers who are not in school but meet the requirements, they're a lot of young dairy workers. They used to be almost exclusively men. As Naomi was saying, we are now up to 20% female in our out of school population. So that's been really interesting. And then different dynamics on young women who are parents of kids who are back in their home country, and how is that affecting them? Families that are reunited. So a worker who has been here for 5 years and has finally gotten the money and the stability to bring a family here, and then suddenly is the parent of a 6-year-old that they have maybe not met, they maybe only knew when they were a baby, or the parent of a teenager that they haven't seen since they were 5. And how does that parent navigate parenting? How do they navigate interacting with the school system? So we're there to try and support everything that's going to help the students who qualify to meet their educational goals. I think a lot of what has been said already, I would also say that like the young workers are experiencing. So I'm going to focus a little more on kids with the time that we have, but we are seeing, people are afraid to even open their blinds. People are afraid of racial profiling. They're afraid to go out, and people are not sending their kids to school. They don't want their kids to be exposed waiting for the bus. They don't want their kids to be walking to school. They are concerned about the bullying that they're hearing about at school, and kids who are repeating things that they hear at home, or they're repeating things that they hear on the news. And people are feeling, threatened. So we have a lot of conversations with families and with schools about how to navigate that. I was just talking to one of our regional coordinators. We have a staff of 4 regional coordinators, kind of like Naomi's community health workers that, and I was just talking to one of them who said that in the last couple of months, he's talked to 4 different families and schools to like navigate kind of racist comments and bullying that's happening in schools. And I know that if 4 people are calling someone, there are a lot of people who are experiencing that. These are mostly, these are schools in farming communities, and a lot of times it's the 1 kid or the 2 kids. We're seeing.
Question from Representative O'Brien.
Yes, go ahead.
What's the population of the school age?
We have last year we had, don't quote me on this, like 120 kids in school. The graph of age, I was just looking at it, we've almost 40 3- and 4-year-olds, so preschool age. So the graph kind of goes like this. We have 5 high schoolers this year, but the 3- and 4-year-olds, and that bump I expect if people stay, will start to move. So that's a lot to navigate with childcare subsidies and people wanting to work and navigating, kids at home and kids being really isolated. If you're a 3-year-old and you're on a farm and your parents are both working, then what are you doing all day? What kids are you playing with? How are you learning the language? All of that. Schools are concerned. Employers are concerned. So one of the things I haven't heard, because I know we don't have time, is that employers, as not just employers are now also asking their staff to stay home. That fear of racial profiling. We're also hearing from farmers who live close to the border that they're scared and they're upset that immigration enforcement is parking on their property and is sitting there kind of using that as a place to watch the road from. And they don't feel like they're able to do anything about that. Let's see, what else do we want to say? People have been detained, right? And so I was at one of our students' graduations last year when I heard about the detention of one of our other students who had graduated the day before. And so people are concerned about racial profiling because of what they're hearing on the news, but also what they're hearing from their friends and family. And that impact is really big and it's intense on kids, especially when they hear the same thing from their colleagues at school. And our staff, especially our staff who are brown, are feeling also concerned about being racially profiled while they're out delivering educational services and supporting families and working with them. And I think I'll leave it there, but I would love to, I'd love to come back in January and give you more of a rundown of of our program, and I'd be happy to answer any questions.
Yeah, thank you, Esme. So yeah, really helpful just again to get an intro to the program and obviously to hear some of what you're hearing out in the field. And you mentioned, so funding wise, you get federal funding, it sounded like.
Yeah, most of our funding is the federal program that goes into
Passes through the state?
Yeah, passes through the state and
Okay.
it's sub-granted to us.
Yeah, and so right now, given where we are with the federal budget, you're good until January, the way,
June.
until June.
June 30th.
Okay,
And then, but usually we find out in the spring what the allocation is for the following year. You know, it's a renewing grant and it's a formula grant. But last year, we didn't find out that we were going to get anything until the middle of the summer. At which point we were already working on the rainy day funds that have been held by the state.
any other questions?
There's a 4-year-old that's the best translator ever.
They learn so fast, but that's
She is so sharp.
people are so worried about also the, you know, in terms of federal education funding, like, will we continue to fund English language education?
Representative O'Brien, question?
Yeah, I just wondered, do towns pay the tuition or the per pupil cost for the 120 students, depending on what town they're going to school in, or is it,
No.
does it come through you, your
Yeah.
organization?
Yeah, it all comes to us for the whole state and it goes where it needs to go.
But so sorry, I just want to clarify, do you need the tuition for the person to attend the school or the support that they provide?
The tuition, so if I'm, you know, in Newport and I'm going to high school, say at North Country, you know, is
Like any other
Newport?
kid.
it
Oh,
is
yeah, like any
other
other
kid.
kid.
Yeah,
Yeah.
okay.
Sorry, I didn't, thank you,
You're,
Naomi.
you're one of the average daily members.
Everyone who's enrolled in school
Yeah.
is to, yeah.
Counted, yeah.
And same rules for, like, you were talking about the 10 hours in pre-K.
Yeah,
Same thing.
exactly.
Okay.
Yeah, and that's one of the also concerns, like currently, anyone who is a resident of the state of Vermont has access to a free and doesn't already have a diploma and is within the age band, has access to free education.
Okay.
All right, thank you
Thank you so much.
very much. Jill, are you online? Okay. We're going to stand up and just move around for 3 or 4 minutes. And then